YouTube. All right, YouTube, it's Clear Vision Wednesday time. I am Claudia Mühlenweg, a natural vision improvement teacher and Bates teacher. I've been doing this for over a decade, helping my clients to improve their eyesight naturally. And this is my weekly live show called Clear Vision Wednesday. And today I'm super, super excited to have an awesome guest. Like sometimes it's just me. Today we have a guest, and the topic is basically the silent oral problems that can lead to vision problems. And that's definitely something where I was like, dental, like I didn't think about it. I listened to what my dentist said, take the fluoride, had the mercury fillings as a kid. I grew up in the 60s in Germany where flossing, like nobody flossed, we just brushed our teeth like this. I never thought that could have anything to do with my eyesight. And today, again, we have this special guest, Dr. Sanda, and I will just share just a bit about her, and then we're going to bring her on. So she is basically a biological periodontist and dentist here in Los Angeles, and she's also a nutritionist. So she looks at this not just from the teeth and how you brush them and how you clean them and all that stuff, but the whole connection, right? And that's what I'm all about as well. She is also, I have to look this up, I don't remember, she wrote a book called Heal Up, 7 Ways to Foster Healing and Optimum Health. And she's also the founder of Orasana, which is a natural product line, food, mouth, body reimagined. She's been on TV, on the show The Doctors, on Fox, on ABC and NBC networks, and so on. And then what else do I want to say? I think that's about it. So Dr. Sanda, I'm going to bring you on. I'm going to add a spotlight. So you're still muted. So welcome, welcome.
Thank you very much, Claudia, for having me. I'm very excited to share with you some principles of biological dentistry and how some silent oral problems can be related to eyesight.
Yeah, and I'm wondering, like, how did you get into this whole, like me, right? You're not born in the United States. You are from Europe. So maybe share just a little bit about your background and how you ended up in this field. And then go on with brilliant teaching.
Yeah, Claudia, I actually went to UCLA to finish my periodontal residency, which is a 3-year residency in oral diseases. And when I finished, I was doing all kinds of procedures, and I didn't understand why some people healed well and some people didn't heal so well, even though I did exactly the same procedure. So I ended up studying nutrition, going to functional medicine courses, and really understanding how the human body heals, because we really weren't taught that in school. And I think that's the missing link with a lot of these specialty things. We only focus on that part of the body that we're studying. Like cardiologists focus on the heart, the periodontists focus on the mouth and the gums, but really cardiology and periodontology are very much related, because we know periodontal disease affects the heart. But yet cardiologists would never ask you, do you have gum disease, when you actually have a heart problem? That's just to give an example. So by me studying functional medicine, it really helped me to look at the overall scope of work. And then I went on to study biological dentistry, and I'm part member of IAOMT, which is International Association of Oral Medicine and Toxicology. And that's where you can find a lot of resources about biological dentistry, biological dentists in your area, perhaps. And it really helped me to identify toxins in the mouth, eliminate them, and I really saw a change in my patients' overall health. So I no longer practice like a traditional periodontist, because once you learn, you can't unlearn something. And I'm seeing a much better success rate, even in the terms of my surgeries, and just the way people feel overall, which is amazing. That's what makes me happy, really, and gives me satisfaction.
That is super cool, and I'm absolutely 100% with you on board on this, because I feel the same way. Like I always say to my students too, like you can't unlearn, right? Now that you know these things about eyesight, you can't go back to the old ways. And I love how you how you notice that some people heal better and some people don't, even though it's the same procedure. And the same goes with eyesight. So I'm going to shut up now, and we're going to take it away and have your presentation. And just everybody watching, if you're live on YouTube, you can ask any questions and we will answer them live. And if you watch the replay, obviously you can also put comments in the comments and we will do our best to answer them. All right, so take it away, Dr. Sanda.
Okay, I like to share my screen here.
Yeah, go ahead. You should have the powers.
It's just asking me to open system preferences. Hang on.
That's the Zoom. Sometimes the Zoom.
Zoom does that.
Yeah. If that takes a little while, I can fill in the blanks. And
yes.
Yeah. Okay. Okay. So yeah, I'm just curious. Like my Clear Vision Club people are with me here on Zoom with me and Dr. Sanda, and on YouTube, I don't see anybody. I see people watching live, but no comments. And I know you have to have a YouTube account to comment live. But if there's any questions so far, like let me know. And even if they're from Clear Vision Club, you can just post in the chat. Anything. For instance, I had, I wasn't aware, I got a tooth whitening gel from, I'm going to switch to your practice, definitely. But I've been with another dentist and he gave me a teeth whitening gel. And that created edema for me. Like my legs were swelling up. And so I was like, I've never been allergic against anything. So I wasn't questioning, or when they said put fluoride on your teeth, I used to do that. Now I don't do that anymore. I don't have toothpaste. But yeah, there's a lot of things that we're just not aware of. And so this is why I'm so excited to learn from you. And I think what you mentioned earlier is the toxicity, right? Because like people with mercury fillings can have all these long-term effects later that we don't know about. And sometimes it's decades later and you don't really tie those two puzzle pieces together because, I had these fillings as a kid and now, 20, 30, 40 years later, there might be an eye disease and you don't even think about those mercury fillings anymore. So are you able to figure out the things? So you have to go to your system preferences. It's a little annoying. And if you can't do it, then we can just do it without the slides. It's always nice to have some visual
information. Good slides for you too, but for whatever reason, it's not allowing me, I think because the recording is on, that's why.
Oh, okay, okay. Well, I also see, let's see, there's some questions in the chat. What about, yeah, okay, well, maybe, do you think you want to figure this out, or are we just going to go without the...
I could see it, I'm just not able to click on it to check it, to add it, which is interesting, the screen.
Oh, we probably have to like shut Zoom down, so we probably won't be able to do it. That's okay. This is all, going live always means you have to, you have to be MacGyver and figure things out when things don't go as planned, but that's totally okay.
Hang on one second.
Okay, okay.
I think I might be able to unlock this.
Oh yeah, you have to go. Are you on a Mac?
Yes.
Yeah, you have to unlock the little system preferences.
I have to quit and reopen.
Yeah, the system preferences or Zoom?
The Zoom, so I'll be right back.
Okay, okay, she's gonna be right back. So anyway, but the slides are gonna be awesome because if you're a visual learner like me, I like to see pictures and words. And especially when you're like, for me, seeing a word written down is a lot easier than just hearing it. So I will just look at some of the questions that we have on YouTube. We have, hi, Mike. Okay, yeah, he put in the book, awesome. And so basically there's some questions about fluoride toothpaste. Was told to fluoride because of tooth sensitivity. I have heard it contributes to Alzheimer's. Yeah, so that's a question from my Clear Vision Club people. And Dr. Sanda didn't hear that right now. But we will go over all this. You got it, yay. Let me, cool. I'm gonna add a spotlight to you and then you can go ahead and share your screens.
Awesome, yes.
All right. Cool.
All right. So you can see this, yes?
Yes, we can.
Awesome. Let me play this. So basically, I really want to talk about this because a lot of people say to me, I don't have any pain. So why should I go to the dentist? Nothing's bothering me, these metal fillings. Why should I change them? So that's what I really want to talk about today and answer some of these questions. So really the objectives for today is talk to you a little bit about biological dental principles. And some of you might not be familiar with biological dentistry. Gum health. What do we know about the microbiome? How do we practice differently today? Some of you might have gone to the dentist and had a deep cleaning. We're really more microbiotic specific in terms of treating gum disease. Cavitations. Are you familiar with cavitations? These are silent jaw infections that can affect not just your eyes, because it exhibits chronic inflammation, but also it affects your overall energy and your health. I want to mention a little bit about root canals, because this maybe some of you have not heard about the controversy against root canals. Like most of them, the problem are filled with bacteria, and you don't even feel them because it's a dead organ. So I want to talk a little bit about that and how it affects your eye health. And of course, I want to also mention mercury fillings. Those are those silver fillings that, if you look in your mouth, you might see this darkness hovering over your tooth or inside the tooth. There's some great research how mercury affects the eyes. I will mention that, and how can we replace it safely? Because really, when we work with mercury fillings, those vapors can actually cause more toxicity than when you have them in your mouth. And if you stay until the end, we have some really special offers for everyone that I think you'll enjoy. So what is biological dentistry? Biological dentistry is really dentistry that unites not only modern technology in dentistry, but a clinical awareness that whatever we introduce in the mouth in terms of dental materials, in terms of how we clean, affects the rest of the body. One of my coaches always used to say that, as dentists, we are affecting our whole body by working through the mouth. So here's an image of what in our office with the kind of technology we have today. This is basically me working on a patient, and I'm looking at a 3D microscope, and it allows me to really magnify the teeth so I can see better. So I'm actually looking at a screen, not at the patient. And I'm wearing 3D glasses, but we work with lasers nowadays. We have digital technology that allows us to check the bite. So dentistry, as you might have known it, has changed significantly. Biological dentistry really looks at improving the patient's quality of life by introducing materials that are biocompatible. So in the past, we were just using any kind of materials that, we thought were antimicrobial. For example, Listerine mouthwash, mercury fillings. These actually don't benefit the mouth. Listerine is too acidic, for example. It has a pH of 3.5. If you actually use it regularly, you might actually develop sensitive teeth because of that acidic pH. Mercury, for example, it's not being placed anymore. Biological dentists understand the importance of placing biologically compatible fillings, but also removing it safely. Fluoride-free, mercury-free, and mercury-safe. Fluoride, you might have heard the controversy of fluoride. Do we need it? Do we not need it? Does it really help with cavities? But if you actually look at the research of fluoride, we don't actually have good studies that fluoride significantly decreases cavities. In biological dentistry, we don't use fluoride products, especially in kids, because they might ingest it. Fluoride in itself is toxic, and it's found in a lot of let's say antibiotics, for example, ciprofloxacin. Ciprofloxacin is one of those antibiotics that contains fluoride and can be very toxic. As a matter of fact, one of my colleagues, my dear colleagues in LA, he actually helps people detoxify from fluoride induced antibiotic toxicity. Mercury-free. In biological dental offices, you will not find anyone that would place mercury fillings, as they are toxic. But we are mercury safe. The way we remove mercury from the body is very, very important, because the EPA allowance of the vapors in the atmosphere is 2,000 times higher than allowed by the EPA when we actually remove dental amalgams. Typically, traditional dentists remove dental amalgams with no protection. So that dental amalgam material that's residual or in the atmosphere gets inhaled in your body, and not just in your body, but in the dentist and the assistants. So there's a lot of dentists toxicity affects neurologically. Also, testing for biocompatibility. We are all different. So we understand that a filling can affect two people completely differently. It might be compatible for one person, but not compatible for another. So it is very typical in a biological dental office that we would offer a blood test so we can test 600 to 700 different dental materials to see what exactly your body is compatible with. And we will actually pick a material from that list to ensure that you're not going to have a reaction. And in my practice over the last 20 years, I've seen people with reactions to, let's say, those bonding materials, those white fillings. I've seen people with reaction to cements that were used to place crowns. I've seen people allergic not just to maybe gold fillings, you know, those gold crowns. Some people think they're safe, but they're not 100% gold. And whatever alloy is there can be actually causing a reaction in someone's body. So this is how biological dentistry really affects overall health. And we want to understand this oral systemic health connection because it's inseparable. The mouth is not disconnected with the body. And we know a lot more today, and we're able to bring you really a safer level of dentistry. The acupuncture meridian system has been set, of course, not by dentistry, but we follow it as biological dentists. And if you look on the left, I actually have a tooth chart. And on the top row, you have the top teeth. And the bottom here, you have the bottom teeth. And each set of teeth, like for example, the molars are connected to digestive meridian and lung meridian. The premolars may be connected to breast health. But the eye meridian here is really connected to, some of you might have heard of eye teeth. Right? The eye teeth are the canines, not only on the top, but also on the bottom. And, you know, when we talk about the meridian, sometimes it kind of spills over to the premolar right behind the eye tooth. So what does this meridian really mean when we're talking about oral health? Let's say you have an infection or a root canal with an infection that you don't know about. Infections sometimes go silent. In the eye tooth, you actually can have a disturbance in the vision in that same side. So let's say the right upper canine has a cavity or has a root canal with an underlying infection. You might have disturbances on the same side of the face, disturbances in the vision, for example. So it's always important that if you notice any kind of eyesight changes, especially that's related more to one eye versus the other, that you have a thorough checkup with a biological dentist. And what does this entail? Usually it entails taking a CT scan. The regular dental x-rays, which dentists use in the office today, can only diagnose 50% of the problems. So 50% of the problems are being missed. Oftentimes I get consultations in my office as a second opinion, and they say, you know what, I'm having this issue. Nobody can figure out what it is. My next question is, have you had a CT scan? I would say 99% of the time they haven't. Once we take a CT scan, we're really able to see inside the jawbone to see if there's any kind of correlation between the teeth and that side of the face or that side of the body, and to see how it might affected by underlying chronic infections. Certain infections, again, cannot be diagnosed with the regular dental x-rays, only with CT scan technology. We have a digital CT scan machine in our office at Beverly Hills Dental Health and Wellness and Encino, and we cannot live without it. Pretty much during a biological dental exam, it is absolutely necessary for everyone to have a CT scan. Even if your teeth are perfect and you've had, let's say, wisdom teeth removed, and I'll explain later on why we check every site that's had a tooth removed, because it might be infected. So various organs here in the body, we call them, can be associated with these energetic highways. And you can see here on the right side how it passes from the top of the crown head through the teeth and sometimes to the shoulder, the joints, the hips, and all the way basically to the toes. And if this energetic pathway is open and it's not blocked in any direction, then it's conducive to overall health. Let's jump into talking about periodontal conditions and jaw infections. Some of you might not even know what a periodontist is, which is really great. That means you've never had to deal with one. But the peri means really around, and dental is the tooth. So really periodontal means around the teeth. So periodontists specialize in diseases that affect the gums, the bone, basically what surrounds the tooth, and sometimes even sinuses. Here on the lower left image, you can actually see somebody with advanced gum disease. So you see the gums kind of have retracted upwards on the top teeth and have retracted downwards on the bottom teeth. And you could see these spaces in between the teeth. This was used to refer to as being long in the tooth. That is a gum disease issue. Some of you might not be as severe. The other thing you can see on this person, you see the gaps between the teeth. That's because due to the loss of bone, due to gum disease, the teeth are splaying forward. So if you're noticing some of your teeth are starting to shift, it might be due to gum disease. And the issue with gum disease, let's say somebody like you see here on the lower left doesn't have any pain. And that's the biggest problem. Periodontal disease, I always refer to it as kind of like cancer. It creeps up on you. And by the time you actually get symptoms, meaning your teeth are getting loose and painful, it could be that your gum disease, it's so far gone that I cannot save the teeth. But if we actually catch the teeth earlier than what this picture shows, I can actually reverse that bone loss, reverse the microbiome, and periodontal disease can be treatable. But unfortunately, the only symptom that we have with gum disease most often is bleeding gums. And the NIH studies show that about 80% of the population has bleeding gums. And you might notice it. When do you notice it? When you brush your teeth, when you're flossing, if you see the bleeding gums, you might have gum disease. It might not be just, a little inflammation. Here on the lower right, it's a little cartoon that shows the progression of gum disease. So you see the tooth here, and then we have it's called the alveolar bone, into which the jawbone, into which the tooth is sitting. And there's a little space here. It's a little muscle attachment around the tooth and then connected to the bone. This is called the periodontal ligament. It's a little muscle attachment that holds the tooth into the jawbone. And the gum here, this red part where I insert my periodontal probe, you can actually see the redness in the mouth, and the bacteria slowly creeps underneath the gum. And then we jumped into moderate periodontitis. You see the bone level has started to go down. And then finally, advanced periodontal disease, when pretty much more than 50% of bone has been lost around the tooth. So here's somebody that might show periodontal disease. You see that these are beautiful crowns actually, and this redness right in between the two front teeth. But you also have redness on the side here. So one might be the cause of this. Yes, it's gum disease, but also it might be induced due to poor crowns that were done by the dentist, or it might be as an allergic reaction to cements. Or when we see actually ulcerations, like on the right side of this picture, that could be related to even leukemia or other systemic problems like diabetes. So we always say periodontal disease is a chronic disease. It's a systemic problem. It's not just a gum problem. Basically, your immune system is reacting to something, and it's usually bacterial in nature. Here's another picture of the two front teeth. You see healthy tissue on the left of the front tooth, but really red and angry tissue on the right side. So that's basically a lot of bone loss, and that's how periodontal disease manifests. And in both of these patients, which are patients of mine, they don't have any pain. Their only complaint is bleeding. And here's someone else here. She's a patient of mine, and you can see she's got two titanium implants at the two front teeth. You can actually see the gray shining through the gums. And that's basically what titanium implants can look like, especially if you have bone loss. Usually if there's bone, you're not going to see this grayish part of the titanium. There's not a lot of redness in the gums, but look here, there's like a little pimple up above the tooth. That is called a periodontal abscess. And that abscess itself is due to bacteria that's being stuck under the gum, causing bone loss. So what would I do in a case like this? As a biological periodontist, I would take a saliva test. I really am interested in seeing how this manifests. So a typical saliva test is called an oral DNA test. It's a lab that was started by a periodontist, I want to say about 10 years ago. And really, we are testing for 11 different types of periodontal bacteria. You see here, we have a high risk group. Then we have moderate risk pathogen and low risk. But what I'm interested in is really these two groups of high risk and moderate risk pathogens. And what's interesting, one of them, which is here in the middle, is called Porphyromonas gingivalis, has been shown to invade the human retinal pigment epithelial cells. So it invades the eye. So how is this important to eye health? Let's say you have a Porphyromonas gingivalis infection, right? You're flossing your teeth. You get saliva on your hands. Next thing you know, you're rubbing your eye. It's easy to transfer periodontal pathogens from the mouth to the eye. Or you're putting your hand in your mouth. I see people doing this all the time. Even sometimes I do surgery. The next thing I know, their hands in their mouth trying to feel something, and then they put it, rub their eye. You can't do that. There is a transmission of bacterial pathogens. That's one way in which periodontal disease affects eye health, by the bacterial transfer from your mouth to your eyes. The other microorganisms don't seem to survive in the eye, but Porphyromonas gingivalis is not just involved with eye health, but it also travels, just like all the high-risk bacteria in this group. It travels to the brain, basically causing cognitive decline, brain fog, travels to the joints. AA, for example, actually is involved in causing mitral valve issues because it actually can affect and inflame the valves, causing prolapse. Fusobacterium nucleatum, for example, is strongly associated with gastroesophageal tumors. So that's why this is important for me. So what do you see these in this oral DNA test? When you see these colorful bars, what these actually are is really the level of bacteria. And this particular patient has really high level of bacterial pathogens. This is a systemic problem. I know as a biological periodontist, this is not just in her mouth. It's everywhere. She actually came in and she said, you know what, I do have bleeding gums, but actually my joints really hurt. So her problem was not exactly the mouth, just because she noticed bleeding once in a while, but actually her joints hurt. So in this case, I might even give a systemic antibiotic when I treat this patient, or a really strong botanical supplement, such as Orasana's Botanical Cleanse, to help me treat this patient properly. So periodontal diseases are strongly linked with diabetes. And we know diabetes is strongly linked with eye health. So there's this connection, this triad here. So what do we know about periodontal diseases and diabetes? The corneal epithelium really has increased defects and poor healing. We can have an increased thickness and stiffness of the cornea. Damage to the endothelial cells, such as the Porphyromonas gingivalis that I talked about earlier. Changes to the bacterial species on the ocular surface. And this is all as a result of like poor glycemic control, let's say, and chronic systemic inflammation. Decreased corneal sensitivity due to a loss of nerve density. We know neuropathy is a big problem in diabetes. And typically diabetic patients have periodontal disease. And increased rates of dry eye disease. This is also a common issue of people that have chronic inflammation. This particular article, and I listed some references also below, and I know Claudia, I also posted them in the links. The presence of periodontal disease was moderately association with the risk of developing infectious keratitis, uveitis, We know that if you have a periodontal disease, which is a systemic infection, it predisposes you to other eye infections. So there's definitely a link between the two. We also know that periodontal diseases and age-related macular degeneration are connected. Macular degeneration induces irreversible loss of vision in older people. But what's happening, why is macular degeneration a problem? It's really a systemic chronic inflammation, and periodontal disease is the same thing. We don't exactly understand what causes what. Is periodontal disease cause macular degeneration? No. But what we do know is that persons with macular degeneration showed more periodontal diseases and more alveolar bone loss than those without macular degeneration. So clearly there's a connection there between eye health and gum health. And one of the things that I also do in the treatment of periodontal disease in our office is really help people systemically with nutritional support. Yes, it is important to have great oral hygiene, right? Use a water jet, use a chewable probiotic and a toothbrush. However, oftentimes we need extra antioxidants. Gum disease is really an oxidant problem. It's too much oxidative stress. Whenever you have an infection, it's basically like a fire. And I always like to refer to antioxidants like the water putting out the fire. So CoQ10 receptors are commonly found in the gums. That's why I highly recommend them, especially for people with bleeding gums. And interestingly enough, CoQ10 is also found in the heart tissue. So there's a strong correlation between heart and gum health. Botanical Cleanse, which I mentioned earlier, is a strong antibacterial and antiviral formula that helps to promote digestive detoxification of these bacterial microorganisms, because after all, the mouth is the opening of the GI tract, right? So whatever bacteria that I measure in the saliva, for sure it trickles farther down in the GI tract. And there have been articles that have shown this in the stool tests to find oral periodontal pathogens. So Botanical Cleanse, it's a botanical formula that really helps to detoxify not just the mouth, but the whole GI tract. EFA blend, and I'm going to talk more about this, very important to have actually omega-3, which is a great antioxidant, on board as well. But chewable probiotics, I want to talk a little bit about this because a lot of you might be familiar with antibiotics or probiotics for the stomach, like the ones that you swallow. And not a lot of people are familiar with the oral probiotics, the ones that you let dissolve in the mouth. And the Orasana probiotics, and I have to disclose that I am a founder of Orasana, and it's a passion of mine to help people support their oral health. It's a vegan certified chewable probiotic blend that is anti-inflammatory, and also it's anti-cavity. This, for example, was a double-blind placebo-controlled study with two groups. One group had periodontal peri-implant disease. The other group was healthy. They were given one chewable probiotic over 30 days. And the reason why I like the studies, they didn't just look at the mouth. They actually looked at the inflammatory cytokines circulating in the body to see if the chewable probiotic actually has an effect. And interesting that it does. It actually shows that just by taking a chewable probiotic daily for 30 days, it reduces your systemic inflammation, which is pretty amazing. So how do bacteria do that? How do little friendly bacteria actually do that? Well, Dr. David Perlmutter, you guys might be familiar with him. He wrote a couple of books. One of them is called Brain Grain. He's a New York Times bestseller. He's a neurologist, functional medicine. He showed that bacteria talks to our genes. Bacteria talks to our cells. So when you have healthy, beneficial bacteria, whether in the mouth or in the stomach, it will decrease the inflammation in your cells because there's this strong relationship between bacteria and our own cells. So more and more studies are coming out on probiotics. I don't have enough time today to really focus on everything, but if you go to orasana.com, we post constantly scientific articles on this. How do we treat periodontal conditions besides the probiotics is through the use of ozone. And we love ozone in our practice, and most biological practices offer ozone, not only in the form of every single operatory, every single line that we run has ozone water, because it's antibacterial, antifungal, antiparasitic, and it also primes our immune system. And if you look at the studies, ozone is 150 times more powerful antibacterial than chlorine, and it's natural, and it works a lot faster. It basically breaks up bacterial, parasites, and fungal walls on contact. And this is kind of how it works. You see here oxygen, which is O2 is in the atmosphere, but then you have an extra oxygen, and this has a weak bond. So as soon as the ozone is being released, what happens is this oxygen kind of breaks free, and because it has a negative charge, it basically destroys the bacteria. It's like a little grenade, essentially, for them. But interestingly enough, is that our cells recognize negative oxygen species because our immune cells, it's called macrophages, actually release these little bombs as natural fighting chemicals. So negative oxygen is actually a species that do great around our cells. We're not affected at all by this. Essential fatty acids. I do want to mention this because a lot of you are taking omega-3, but it's actually also a great thing for Porphyromonas gingivalis. This is that bacteria I was mentioning to you that it affects eye health. And what we do know is that Porphyromonas gingivalis can actually be inhibited or can be reduced in terms of its effect on bone resorption. And also it suppresses fusobacterium, which causes tumors of the epithelium. So omega-3 is, how is it anti-inflammatory? It also reduces the effect that the bacteria has on our epithelial cells. Moving from periodontal disease to cavitations. And I know, this might be a lot of information for a lot of you. And if you have questions, I would love to, please keep them, and I would love to answer them all at the end, as I cannot see your comments. Cavitation. So when we come to our practice, we take a CT scan, and this is a three-dimensional rendering of the upper teeth, of the upper jaw, looking from below. And here is a full set of teeth. You might recognize this, called a panoramic X-ray. And then a CT scan, what that allows me to do is look inside the jawbone. So when I look at this image up on the top, you can actually see little discrepancies inside the jawbone. So for example, this is a rendering of a cavitation patient. If you look up on the top row, you see these little oval looking shaped slices of the jaw. And it looks nice and white. And you see a little small hole right here. That's really like a nerve that's showing. But when you look at the bottom row, you see at the top density of the bone is starting to get darker. So I blew it up here on the right side of the screen. You can actually see the difference. The top half of this bone looks dark. The bottom half has more of these white lacy-like patterns. So the darkness actually is how we recognize cavitation. So in this dark area, there's usually microorganisms growing. And you might be wondering, how in the heck did they get there? Well, when we extract a tooth, it could be a wisdom tooth. See, in the case of the patient on the bottom was just an upper molar, maybe an infected root canal. Bacteria that lives in the oral environment can actually crawl inside the jawbone. So, and it forms a little home there. A lot of this bacteria is not recognized by the immune system because it's smart. It has actually a way to become invisible to our immune cells, and it can live there for years. Sometimes cavitations can go undetected. They can only be detected on a CT scan. Typically, patients with cavitations come to me and say, you know what, I'm feeling really tired, and I heard that I might have cavitations. Or they say, you know what, I have this tightness around my neck, like I'm not feeling good. Some people say, I have heart irregularity all of a sudden. So those kind of symptoms can be related to cavitations. And as a biological periodontist, my role is to clean out these cavitations. How do I clean them out? I actually go inside the jawbone, clean everything out, and I take usually a piece of this necrotic bone, which is what it is. So sometimes it's black, sometimes it's yellow. It's this oozing substance. And if you go to my YouTube channel at the Ask Dr. Sanda, you'll be able to see some of these videos of what cavitations look like. I always biopsy these cavitation sites to see what kind of microorganisms live there. And if you see here on the screen, I have on the left side, there's a name of the bacteria, and the bars just represent the level of the infection present in that biopsy sample that I'm taking out. And you see here on the left side, we have somebody that has about 11 different microorganisms. And on the right side, we have somebody that has a lot more cavitation bacteria than that. And one of them here, Antamoeba species, is actually a single cell organisms or a parasite. 70% of the times we find parasites in the cavitation sites. So the cavitations themselves cause chronic inflammation. Occasionally bacteria parasites from these cavitations enter the blood stream and can exacerbate immune reactions. So can predispose people to autoimmune issues. That's why it's important to have these cavitations taken a look at. So of course, an increased level of chronic inflammation can affect eye health. Curcumin Plus is one of the supplements that I like to use in treating cavitations because curcumin in itself can turn on 300 different anti-inflammatory genes. And it has significant antioxidant capacity to really inhibit and downregulate inflammation. Our curcumin has been studied to make sure that it enters the blood. Some people are asking me, can I just take turmeric? Because really curcumin is the active ingredient in turmeric. You would have to eat 2 pounds at least of turmeric to get 2 capsules of curcumin. So, and the problem with that is that turmeric in itself can actually cause loose bowels. I've actually had a patient with pretty much, she had chronic diarrhea from taking turmeric, and we switched her over to curcumin and she didn't have any problems. So here on the right is, this is in the test tube, we have platelet-rich fibrin. This is blood collected from our patient the day of the surgery, in which we separate this yellowish clot, which is full of growth factors, immune cells, that helps me to regenerate the bone in the side of the cavitation. Because this has been a chronic infection for so long, the patient's own growth factors and stem cells are really the best at healing this. Nothing artificial should go in these cavitations. Of course, besides the PRF, the laser, and the ozone that I use, I want to make sure that our patients are vitamin D3 optimized. So what does that mean? I want everybody to be at about 80 to 100, the levels of vitamin D3. If the vitamin D3 is 20 to 30, which is, if you're not supplementing, that's probably where you're at. It's too low in terms of now asking the body to really mineralize the bone from a cavitation surgery. And what we also know of vitamin D3 is that when it's taken with K1 and K2, we do get better absorption. So that's why our formula has D3, K1, K2. And this is actually a liquid formulation, it's drops. Now moving over from the cavitations to another silent oral problem, which are root canals. There's millions and millions of root canals that have been done, probably billions. And I myself had a root canal on my lower left molar that I no longer have. And every time I floss around my root canal, it always smelled. Even though on the x-ray, I had no problems with it, right? Just like you see here in this image. There was no infection around it, but there was a smell that I couldn't stand. So it happened to be on my meridian of digestion. So as soon as I removed it, I had it removed. I couldn't do it myself. I wish I could. But when I had it removed, I really noticed an improvement in my digestion function. So, you know, through my own experience in biological dentistry, I really became a believer in our system. So what is the problem with root canals? It's a dead organ in the body. Some of them are done well. Let's say they're cleaned well. And, one of my colleagues, actually, who's a biological endodontist, she does a great job into cleaning these root canals. But oftentimes, as you see on the lower left, these white dots, that's what kind of like the root canal looks like. But one canal is missed. So there's a lot of bacteria that's stuck inside that tooth. And see here, this is actually an image of small little dots. Those are actually the opening of the root canal itself. We always say the pulp is the brain of the tooth. So the pulp is really the nerve. The nerve is the brain of the tooth. So what are we doing with a root canal? We're actually killing the brain of the tooth. So if a tooth has no brain, you say no brain, no pain. That's why you can go with a root canal infection with no pain for many years, because your tooth is dead. It has no more brain. So you can see here, this is actually an infected tooth, a root canal tooth. You can see the decay here. There was a crown placed on it. This decay was actually under the gum. It's definitely infected, an infected tooth that the patient didn't have any pain on. Cone beam CT scans are really a way to diagnose infections of root canals. Like on these two images are of the same patient. On the left, it's a regular dental x-ray. If I gave this to 100 dentists, they all would say there's no infection, there's nothing wrong with this tooth. On the right side, there's a cone beam CT scan of this tooth here in the middle. You see this huge dark bubble up around the root? That's an infection, only diagnosed by the cone beam CT scan. So that's the difference between the imaging. When you're looking at so many superimposed images on a two-dimensional level, you can't see anything. We really need that 3D imaging to allow us to see inside the jawbone. And here's where an endodontist, these are the slides courtesy of Dr. Cantor. On the left side, this is a root canal tooth. And on the right side, you see inside the tooth itself, these dark areas is bacteria. And this is an image taken through the microscope, because you have to remember bacteria is microscopic. And this kind of orangey color, it's actually gutta-percha, which is the way we're actually sealing these canals. It's made from a tree. It's a cork tree, actually. And unfortunately, it doesn't seal very well. And that's the problem with it. So a lot of times these root canals are leaky, and they're leaking bacteria in the jawbone. I want to shift over a little bit to mercury fillings due to time constraints, but really mercury can be a toxin that goes undetected and goes silently inside your body. We know that mercury is constantly being emitted from your dental amalgam fillings, and it can affect the brain, the eyes, kidney, liver, lungs, and the GI tract. And how do we know? Animal studies. A classic study was done in the sheep. They put these mercury fillings in the sheep, and a month later, they already had mercury all over their body and all the organs. And unfortunately, I went through that, not through the sacrificing of the sheep, but actually had mercury fillings in my mouth from growing up in Romania. I had 16 huge mercury fillings, and I had them removed. And unfortunately, I didn't have them removed safely, because at the time I didn't know about biological dentistry. And I started having headaches, blurry vision. And when I went to get myself checked by the naturopath, she said, well, you have high mercury in your body, most likely. And I had a mercury challenge test, and actually it took me a couple of years to really detoxify from mercury. It's really hard to get rid of once you have it. So kind of do a self-exam and look at the number of fillings you have. Start to count them. The more fillings you have that are dark, the more toxicity you have in your body. And every time you chew, if you do teeth grinding or you drink hot liquids, mercury vapors come off the teeth. And it must be removed safely, because it can cause a lot of toxicity otherwise. So how does mercury affect eye health? I found some actually really interesting research to show that animals exposed to mercury fillings ended up having mercury in the retina and the optic nerve of the eye within a month of mercury placement. So really, these mercury particles go everywhere once you have a mercury fillings placed. Unfortunately, we don't know if we're ever able to fully detoxify from mercury once we're intoxicated. And unfortunately, there's mercury everywhere. You know, there's mercury in nature, there's mercury in fish. Unfortunately, we're removing mercury fillings, dumping them into the environment, which then the fish ate the fillings and the mercury, and then we ate the fish, and it's like a vicious cycle that we can't get rid of mercury. And we know mercury exposure in humans is also linked to markers of inflammation and autoimmunity. So the higher mercury level, it can affect your heart, it can affect your immunity level, and it can increase the inflammation. And we know mercury is actually taken up by fetal retinal ganglion cells, nerve glial cells, and the pigment epithelium inside the eye. So it's really all over, and it does affect the vision. How do we remove mercury safely? Very, very important. I'm not going to go through the whole process. I think I want to show you a picture here. You know, we oftentimes work with the suction that you see on the left-hand side there to remove mercury safely. And this is essentially what silver fillings, which are usually about 50% mercury, look like. On the left side of the tooth, you see this it's kind of like a light silver. That's a mercury filling that hasn't yet been oxidized. It's fresher. On the right side, you see these corroded fillings because mercury does corrode. And you know at that point when a mercury filling corrodes, corrosion leads to release of mercury in the body. And then here's like a picture of Dr. Tavan Oganessian in our office and our patient. They are basically wearing gas masks to protect themselves against the vapors of the mercury that are being released from removing a filling. And the patient, of course, is always wearing a nose piece here to protect them from inhaling the mercury. And this is what mercury fillings looks like. You see these, if you look in your own mouth, you might be able to identify some of these fillings. And I would highly encourage you to find a biological dentist near you. You can go to IAOMT.org to have these removed safely. And this is what a tooth looks like after we remove the mercury filling. That's what it looks like inside. And always, you see these brown spots inside the tooth. That's basically bacteria causing cavities. And here's what it looks like after removal. This is one of Dr. Tavan's cases. Basically removed the mercury, and on the top is the replacement with biocompatible filling. In this case is a composite that is 70% nanoceramic. So a lot of you that have mercury fillings, just like me, probably are going to have a heavy metal toxicity, and you know, a detoxification of this is highly encouraged. And I highly encourage you to work with a naturopath or functional medicine doctor to determine your mercury levels and help detoxify. Reabsorption of mercury when we detoxify is very common. That's why it's very, very important to have botanical cleanse, for example. That really helps to loosen the stool, to increase GI motility, to help detoxify. The metal detox support is a natural way we use to supplement our patients in order to bind to the mercury and help you eliminate it. I, for example, take this even when I eat fish. If I go out and have some sushi, and I always stay away from high mercury fish, but still, I take a couple of these pills. It helps to bind the mercury and eliminate it safely without me ingesting it. But again, during mercury filling removal, just in case some of those particles are swallowed or ingested, we use metal detox support. Is essentially a super concentrated like spinach juice, a porphyrin ring, which is basically the active molecule in chlorophyll that helps with the chelation. That's what we mean by binding to heavy metals. So here's somebody with gold fillings. What's the problem with gold fillings is that they can have a lot of bacteria underneath, as you could see here once that filling is removed. and then we replace it with something that's biocompatible. And this is somebody in function 8 years later. It still looks just as beautiful as the day it was placed. On the left, you see biomimetic restoration. So what is biomimetic? If you go to beverlyhillsdentalhealth.com, you can learn more about biomimetics. One of our doctors practices biomimetic dentistry. It lasts a lot longer than the fillings you see on the right, which are basically breaking down already. Talk about galvanism, because definitely galvanism can affect eye health. Galvanic currents happen when you have two different kind of metals in the mouth. If you look on the picture on the left, you see this metal, half porcelain crown, a mercury filling, and then right next to it, a gold filling. And by the way, as I was saying, gold fillings are never 100% gold. It's an alloy. In contact with saliva, it forms a battery. So galvanic current is really a battery in someone's mouth. It's electrical energy that's flowing through the mouth that can have significant negative effects on the nervous system, on the brain, and on the eye function. I've had patients that say, you know what, my eye feels like it's strained. And once we remove the metals in the mouth, that strain of the eye actually went away. I've had patients with tingling in their fingertips, people with the whole side of the body with neurological issues. As soon as we removed the metals, that went away. So oral galvanism is really well documented in our literature. And the flow of electrical current that passes through the tooth itself can cause pain in itself. And here again is a picture that I showed you what I explained earlier. Having an amalgam filling next to a gold crown can really cause oral galvanism. So these electrical currents that are produced in the mouth can be actually greater than the electrical currents of the brain. So what does that mean? It's actually going to impact brain health and also can contribute to a wide variety of symptoms and diseases: burning mouth syndrome, lichen planus, and vision disturbances. Metal restorations can actually also impact overall health. For example, Bell's palsy, tinnitus, vision disturbances, chronic headaches, trigeminal neuralgia, bruxism, severe depression, and burning mouth syndrome. If you suffer from any of these problems, I highly encourage you to visit a biological dentist to test for oral galvanism and really have the metals in the body, metals in the mouth removed. And just kind of a summary of everything I talked about. I know there was a lot of information in this 1 hour. Some things to really ask yourself, you know, are your gums bleeding? You might be having periodontal disease. Do you floss or use a water jet regularly? And if you start using one, you might actually see bleeding of your gums. That means you have not been reaching in the right places, and bacteria actually settles underneath the gum and creates chronic inflammation. Do you have root canals? You might not know the answer to this. It's important that you call your dentist and ask them this. Do you have missing teeth? We know that the more missing teeth you have, the higher level of chronic inflammation in the body. Do you have loose teeth? This is usually a sign of gum disease. Do you have metal or silver colored filling? Again, you can look in the mirror and actually count how many teeth you actually have that are metal colored. Do you have a bad taste in your mouth? The bad taste in your mouth might be an indication that you have gum disease, you have an infection in a root canal that needs to be checked with a cone beam CT scan. Or it could be coming from your stomach, from the bacteria that's settled there. Do you clench or grind at night? A lot of our patients that are coming in nowadays have chronic Lyme disease, and they have a lot of cavitations. Any kind of chronic infection actually causes a chronic stress on your body, and it will increase your clenching or grinding at night. Again, IAOMT.org is a great source of information and finding a biological dentist in your area, because I know some of you are not from Los Angeles. I want to get to some of our offers, because I promised you some offers at the end, and then we can get into the questions. I would love to offer you to experience biological dentistry in our office. So we're offering a free CT scan and evaluation. You can call our office to set that up, or you can send us a CT scan. You can find the dentist in your area that does CT scans, and you can send me the CT scan. I'll be happy to evaluate it at no charge, just as a thank you for listening to me today, and for Claudia that has to have me on her program. And also, we have a special offer, 20% off your first purchase of Orasana products. Just use the code below. And I'm happy to entertain any questions.
Wow. All I can say is, wow, I'm blown away. I mean, that was a lot of, can you stop the screen share? That was a lot of, I will put the code into the chat for YouTube. And it's also in the notes, the show notes, so to speak. Let me just put this in the chat. But yeah, that was mind blowing. I mean, we have so many questions. That was really crazy interesting. I mean, I was like, wow, I have a root canal that I got in my 20s. Like I said, in Germany in the 60s, the dental care was just horrendous. And so I can't wait to see you and get that checked. But let's get to some of the questions. So
absolutely.
So on YouTube, so first of all, I have a lot of questions about bleeding. So somebody said chronic bleeding of gums from young age until now. So I guess that's not so much, that's just basically a sign there's something really wrong, right? I mean,
yeah, and actually, periodontal bacteria settles in from our parents. We inherit that, and we've tested this through our saliva test. So if you have a history in your family of gum disease and your gums are also bleeding, the sooner you get that checked through a saliva test, and you can go to, I think, oraldna.com, and you can find out about the testing, or maybe a test in your area. We also ship the tests if you're interested in that. You can do it at home and send it back to us. But definitely address it. The sooner you address it, the better we can help you maintain the bone and the health of your teeth.
So then we have a bunch of questions about the fluoride. So Laurie said on YouTube, with fluoride being toxic and no good evidence that it prevents cavities, are there any good research studies that help support efforts to get it out of our water? I guess that's beyond the scope of this, but basically fluoride is also here in the Clear Vision Club chat. Like, this is still, most dentists still recommend fluoride. So,
yes, it's true. And, some countries, some European countries have banned fluoride. We unfortunately are not there. And there's a great documentary called Fluoride Gate, if you're interested in kind of the history of
Fluoride Gate? Okay.
Fluoride Gate, how fluoride ended up in the water.
Okay, well, maybe we can post a link into the YouTube. Okay.
Yes.
Yeah, and it's added to the water here, which is horrible.
It is, and again, some cities around the United States, I know Oregon State have really banned fluoride from their water. So really, it's city by city. And unfortunately, in LA, if you're in a small town, you might have a better luck to keep fluoride out of the water. Or if you're on well water, that's probably even better. But yeah. I don't recommend fluoride in the water.
I can share from my own experience. I used to have so sensitive teeth, and because before I even went to a biological dentist, let me actually add my spotlight. I started using these little brushes, for the between the teeth. I got them in Germany, and so I started doing that between the teeth because flossing was like, I floss too, and I have a water pick now, one of those water flossers, which I love. But when I started doing that, my sensitivity went completely away. And instead of using the fluoride, this is what, a lot of times in traditional medicine, the symptom is treated, but not the root cause. And I love root canal, root cause. I mean, right? So biological dentistry sounds like you're actually all about addressing the root cause and not just the symptom. And yeah, I had my fillings replaced, not in a safe way, and with composite materials they smelled so strong. So I knew that, what I mean? It smelled like acetone or something, where it's like, it's just so intense that this stuff cannot be good for you.
Yeah, so you bring up a good point, Claudia. It's actually that acetone smell is actually something that's BPA based. So BPA we know is carcinogenic, and the fillings that a biological dentist usually chooses are BPA free. As well as night guards, right, for bruxism. Those can have BPA in them. So make sure you ask your dentist to be BPA free, because if you're grinding at night, you're releasing some of these, chemicals that are inside the night guard or inside the fillings. Or you're eating hot foods, for example. So it's important.
What about Invisalign, those braces?
Exactly. Invisalign actually has BPA free because I asked them. They have BPA free trays, so it's good.
Okay, well, I wish it's kind of, today's show was kind of like, I wish I would have known all of this like 40 years ago, but today is better than never. But yeah, there was a lot of questions about the mercury fillings, and I had mine definitely removed, like, I don't even know when, but probably 20 years ago or maybe 15 years ago, but yeah, and all in one go. And several people here posted in the chat, like they stopped because nobody could do it safely, or one of my Clear Vision Club members just posted, he just had them all done in one go. So what do you say, like, even, like, you do it safely, right? But is it okay to do them all in one go, or should they be done in steps, or oops, your picture is...
advise everyone to start with the mercury test. So if you start with a mercury test, then you know where your levels are. Let's say you're already starting with high mercury levels. Maybe it's good to start a little bit of the chelation, even if it's oral chelation, to start to remove some of the mercury before you have mercury fillings removed. It depends on the level. But yeah, and also it depends on everybody's genetic predisposition. Let's say somebody has this MTHFR mutation, which is, I don't know if you've talked about it before on your show. MTHFR is very, very important in detoxification. And there's actually a very simple blood test for this. Some people detoxify fully. Some people detoxify at 60%. Some people detoxify at 30% based on this one enzyme. So if somebody only detoxifies at 30%, we treat them differently than somebody who detoxifies at 100%. Because obviously they're slow at detoxifiers.
I think I checked, I got my genetics done. It doesn't let me copy for some reason, but yeah, MTHFR.
That's it.
Copy this into the YouTube so that you guys can have it too. But yeah,
Trisha, I think got it right. MTHFR methylation pathway. That's great.
Trisha is amazing. But yeah, getting your genetic testing done. And so, like, let me see if there's any other questions on YouTube. I don't see any. Oh, there was one more question I missed. Do you offer homeopathic after exposure of an X-ray or after use of anesthetics? So not anesthetics, anesthesia. So basically, do you have like any kind of homeopathic or natural products after exposure to an X-ray or anesthesia?
Yeah, actually we do. There's a homeopathic for radiation called Radinex. I'm going to type it in chat. Radinex for radiation. It's a homeopathic supplement, which is great, and not just for radiation from dental X-rays, but radiation from flying, from your iPhone, all kinds of radiation we're exposed to, Wi-Fi in the buildings. I know in my building, there's like 20 Wi-Fis. So it's a good homeopathic that I recommend. And the other thing, just for any time, I would say you have dental work, any anesthetics, things like that, drink a lot of water and take glutathione. Glutathione is actually a great liver antioxidant, and any kind of dental anesthetic detoxifies through the liver. So I highly recommend that you support your liver through any kind of dental work.
Yeah. So yeah, I thought this was so interesting, and we posted the links to all the research studies in the YouTube, the connection to retinal disease, and sometimes, eye diseases, or I always say I hate that they call it age-related macular degeneration, because just we get older doesn't mean we get this, but just years and decades of abuse and these toxins, at some point there's a consequence, right?
Yes.
So sometimes we can't really trace back exactly, like you talked about fatigue, and you talked about some of these things where it's really hard to pinpoint, but most people probably don't think about their mouth or their dental fillings or the root canal. So any of these things in terms of that could be a big factor. And I love that you mentioned the omega-3s, because they are so important for dry eyes. And dry eye is one of the most common things that I hear. And you talked about, I didn't even know that it was also good for the dental support. So it's also good against depression, for dry eyes. So omega-3s, yeah, guys, most people like think of salmon, but you talked about fish, also the mercury. So really good sources are, I take a supplement, even though I eat chia seeds, flax seeds, hemp seeds, walnuts are good in omega-3s, but you still, probably most of us probably need, like, just like you mentioned with vitamin D, we probably need a supplement. And what kind of, I know this wasn't a question in the chat, but what kind of level of vitamin D do you recommend? I heard like 70 to 80 from functional medicine.
That's exactly right. And 80 is usually what I go by. And now I know the Vitamin D Council constantly raises the level. So who knows, in a couple of years, we might be asking for 100. Because really, there have been studies done in the African tribes. Their vitamin D level is 140, and they don't have toxicity because they're outside all day. So I think 80 is a very conservative level.
Yeah, and got mine tested 3-4 years ago, and it was like 38. And I live like you in Los Angeles, right? There's lots of sunshine.
Yeah.
I'm outside, but then I had to take like 20,000, I used a day to even get to 80. So anyway, I'm just looking for here, one more thing I wanted to share that I thought was cool, because you mentioned mouthwash. So I'm doing construction in my backyard, and I found, like, my contractors found this bottle of Listerine. It says Lambert Pharmaceutical Company. So it's
Wow.
like, so this bottle, my house is 100 years old, so this bottle is at least 100 years old. But yeah, like, so, I don't know, nobody asked about mouthwash, but I think it's very common for people to use these kind of Listerine products, or you mentioned a little bit, but what's the difference, just to finish this up on YouTube, what's the difference between something like Listerine that kills everything, and you mentioned a cleansing product that is antiviral, antifungal, antibacterial? Does that basically save the good stuff and kill the bad stuff, or?
So we don't have any product out there that kills the bad stuff and save the good stuff. Antibacterial is antibacterial, so it really wipes off the entire biofilm, whether it's natural or it's chemical. Like Listerine, for example, has essential oils in it, but it also has alcohol. And that's one of the reasons I don't like it. And they do make Listerine alcohol-free, but still has a pretty low pH. And the low pH really sensitizes teeth, and it causes the brittleness in the enamel. That's why I don't like it. So if somebody likes mouthwashes, just make sure it's pH balanced. And we're looking for a neutral pH around 7.0 that really doesn't weaken the enamel of the teeth. But chlorhexidine is another one that is commonly used, like it's called Periodontal by periodontists, and it's a toxin. Chlorhexidine really kills cells. So I was used to it from my residency, and then I switched to a more natural product called Triology. That's a mouthwash that's aloe vera based with essential oils that actually has been shown in study to be just as effective for people with bleeding gums, for example. But in general,
I got that Periodontal before from a dentist back in Germany, I think. Yeah. Sorry.
Yeah. Yeah. So you know how it is. It stains the teeth. It's bad taste. It's metallic. But I don't recommend mouthwashes. If somebody has a healthy mouth, mouthwashes tend to kill all bacteria, and we need beneficial bacteria. I think if anything, practice good brushing. Like I'm a big user and believer in the water floss because of the studies that we have. We keep the biofilm to a minimum, but we don't kill the beneficial bacteria. And then the chewable probiotic really helps to supplement beneficial bacteria, because we really want to nourish our mouth. We don't want to just constantly kill microorganisms. Actually, we know that if somebody has a sterile mouth, they can actually have ulcerations in the mouth, because our skin is actually protected by the naturally occurring friendly bacteria.
Wow, this is so interesting. I mean, you gave some tips on one of the slides. So I'm going to put them in the YouTube description. Like, what are things people can do, like, as a takeaway? What can you do, like, that, because a lot of people might not have a biological dentist nearby. So you can send if you get CT scans done, you can send them to Dr. Sanda, and she's going to evaluate them for free, which is awesome. And we put a link in there for the Sanda products with the coupon code. But what are other things that everybody can do? The supplements you listed. Like you mentioned, one thing I wanted to ask, actually, you talked about a bamboo toothbrush. So I have the Sonicare, which is recommended, the electrical toothbrush. What is it? Ultrasound, not ultrasound, like I'm blanking on the name, but
ultrasonic. Yeah, you got it.
Ultrasonic. So you don't think those are good toothbrushes to use? Because I feel they help me. Like, I like them. Anyway, keep going.
Okay. There's nothing wrong with them. They actually clean well. The EMFs is what really some of the problems are, but if you like it, you can use it. If people have thin gums, sometimes I tell them to just use it on the lower power, because they tend to create recession, especially for people with thin gums. So if you're prone to gum recession, I would say just use the sensitive type brush head, which is a lot more delicate and softer.
Good. Okay, thank you so much for that. But yeah, it's like, I think the lesson I learned today is question everything. And when you have a suspicion that something doesn't feel right, then ask the good questions, do the research, reach out to Dr. Sanda. I think you gave your information on the last slide. Maybe we can put that in there. Well, I put the thing in your website in the YouTube chat, so they can reach out to you. And your YouTube channel, I don't know if you can put a link into that, maybe, because you said you have a bunch of good videos on your YouTube channel.
Yes.
Okay, well, let's see, there's one more question. Are any of the Orasana, I screw up the pronunciation of that, sold on their own or only as bundles? That was a question that somebody had. Can you buy them on your own, or are they bundles? She only sees bundles, she said. Oops, you're muted, Sanda.
Oh, you can buy them on their own as well as bundles.
Okay. Okay, one last question. This is the very last one. What about oil pulling with coconut oil? You know how you can do that, like oil pulling is Ayurvedic practice. What do you think of? I use castor oil, but I don't do it like consistently. So what do you think?
So I actually looked into the research of this because I had to come into for a TV station. We were doing looking into oil pulling. And, oil pulling is an Ayurvedic technique that was 6,000 years ago. And they initially did it with sesame oil because it was cheap at the time. Basically what happens when you swish oil back and forth in between your teeth for 20 minutes, it becomes like a soap. And that soap cleans the bacteria. Now, but you have to do it for 20 minutes. If you do it less, it doesn't work. So if you have 20 minutes in the bathroom, by all means, I don't. I'm usually, so that's why I like to use the water jet, because it gives you, a nice clean. It goes actually up to 6 millimeters under the gum, the water pulsation. So I could be done in 90 seconds versus 20 minutes. So, and the studies that I've seen shows that, the oil pulling helps with inflammation of the gums, for sure. It helps with inflammation. You can use coconut oil if you want. But I would say just be careful. People that have gum disease, I have seen a couple of articles where people inhaled droplets of the oil with the bacteria, and they actually got infection. They got pneumonia. So because periodontal pathogens love to live in environments where nobody can reach them, and they're oxygen free. So
wow. Okay, so if you do oil pulling, do it for 20 minutes. I definitely never did it for 20 minutes. That's a long time. And make sure you don't inhale or swallow any of the stuff that you want to swish out. So
that's right.
Thank you so much. The Clear Vision Club group will have a few more minutes with you on Zoom. For YouTube, thank you so much for watching. I hope you found this as informative. You can watch this as many times as you need to, because there was a lot of information, and we put all the links to all the resources into the chat, as well as your website, Dr. Sanda, and the Orasana, the link. I put all that in there. So thank you so much. And this was amazing. I can't thank you enough for coming on. I learned a lot of stuff, and I will definitely change some things around my dental healthcare. So goodbye on YouTube, and we will just stay on Zoom. And so goodbye, YouTube. See you next Wednesday. We have an amazing guest next Wednesday. Bye.